Your child or you, as a teenager, may have just received a cancer diagnosis, and you might be wondering how that's even possible. How is it possible that even children and adolescents can get this disease? You may have heard that the likelihood of developing cancer increases with age because over the course of a lifetime, genetic mutations accumulate, either randomly or triggered by external factors like sun exposure, cigarette smoke, or alcohol. What's really important to understand first is you did nothing wrong. To this day, there is no exact medical explanation for why children and adolescents can develop cancer. You definitely can't catch it because cancer is not contagious. And that means there's nothing you could have done differently to prevent the disease. The reason we still know so little about the causes of cancer in children and adolescents is because the disease is rare in young people, and each type of cancer has its own unique characteristics. That makes research especially difficult. You also can't simply apply scientific findings from adult medicine to children because children aren't just small adults. Their entire bodies function a bit differently. That's why there are many differences between cancers in adults and children, or rather, between younger and older patients. But one thing is always the same. Cancer begins when cells in the body start to change and grow uncontrollably. Normally, cells work together as a highly effective team. Everyone knows exactly what their job is, and they all give their best for the common goal. Let me show you a little bit of that. So normally it goes like this. These are the normal cells. That's why they're nice and pink and look good. So the cells are there in the body. Here they are. And they divide. That means they also grow sometimes. Then some go away again because they've served their purpose, right? And then new ones appear again. So let's put all the healthy cells here. Let's do all of them. There we go, bam. These are basically the healthy cells. They divide and slowly grow. And after a certain amount of time, the cells die off. Completely normal, just like, for instance, skin cells. For example, you lose skin flakes like this. That's totally normal. But sometimes, during this cell division, or rather during cell division, mistakes happen. That means a completely normal cell, which is actually perfectly fine like this, turns into one that isn't. So that means something's not right there. So it looks something like this. What's important is, every time a cell divides into two new cells, it passes on a copy of its genetic material. That is, the blueprint. And this is basically the blueprint for the entire body, yeah. And anyone who has a copier or printer at home knows how prone to errors this process can be, right? So it can happen that the blueprint gets corrupted and isn't passed on accurately. That means there are errors in the blueprint. And that in turn can trigger cancer. And then from that one faulty cell, more and more are created. And you can already see that's not how it's supposed to be. Medical professionals believe that these initial cellular changes in children with cancer often occur even before birth. Certain genetic events may cause that over time, further errors are added and accumulate, leading to cancer. It kind of just keeps going, yeah, it just keeps increasing. And in some cases, an initial genetic mutation may also have been inherited. It is assumed that this could be the case in about 1/10. That is, 1 out of 10 patients, meaning 1 in 10 children with the diagnosis cancer. But that doesn't mean such a predisposition is passed on to all children in a family, right? And even if a genetic mutation is inherited, it does not automatically lead to the development of cancer. If you or your child have a hereditary cancer risk, then talk to your doctors about what you can do as a family, whether, for example, it makes sense for you as parents to receive genetic counseling and whether you or your other children should also be checked again, possibly for genetic mutations. So just take the time to discuss it calmly and take another careful look at everything. What are the most common types of cancer? The most common in children are leukemia, lymphomas, and brain tumors. These types of cancer are rare in adults. On the other hand, children almost never get breast cancer, lung cancer, colon cancer, or skin cancer. And another difference between children and adults, the vast majority of children with cancer can be cured. Children generally respond much better to cancer treatment than adults and recover more quickly from it. And of course, there is intense ongoing work to continuously improve therapies, that is treatment for children with cancer, so that you or your child will feel better again very soon.